Chloe, I'm Jenny and I'll be your nurse today, and we will be doing a head to toe assessment. And I am cleaning my hands right now, and I've made sure that we are in a quiet environment for this. And her temperature is 98.6, her respirations are 15, her pulse is 68, her blood pressure is 116 over 68, and we do not have an O2 SAT machine, so I'm not able to do that. And are you currently in any pain?
No.
Okay, so 0 out of 10 for pain. And overall, she has clean hygiene. How old are you?
20.
Okay, and her age, her stated age is consistent, or her age is consistent. Her looks are consistent with her stated age, and she is well nourished, well developed. Can you stand up and walk right here and then walk straight back? Perfect, thank you. She has a steady gait. She has full mobility and balance. She has upright posture, full range of motion, no deformities, no irregularities. She is using no mobility aids. What is your native language?
English.
Okay, so we do not need an interpreter. Her speech is clearly articulated and clear. She is able to answer simple questions with answers. What is your name?
Chloe.
And what year is it?
2021.
And where are you currently?
My house.
Okay, so she is awake, alert, and oriented ×3, and her mood is calm and appropriate, and her clothing is appropriate for the setting and what we will be doing. So you will take your hair down. Perfect. Her head is normocephalic, hair is brown, it is smooth, I see no apparent lesions, and it is clean. Her face is symmetric, I see no weaknesses. Her skin color is consistent with the rest of her body, and her skin is warm to touch. It is smooth in texture, it's moist. Her bony structures and prominences are size appropriate for her head. And then I'm gonna feel her TMJ. Is that tender at all? Okay, no crepitus. And then if you will open and close your mouth. Okay, she has full range of motion. And then if you will clench your teeth. Okay, so cranial nerve 5 is intact. And then if you will smile, and then frown, raise your eyelids, shut your eyes really tight, and then puff out your cheeks. Okay, cranial nerve 7 is intact. So now we're gonna move on to the eyes. And if you will hold this about 14 inches away, and if you will cover your right eye and recite the last line that you can read clearly.
3, 7, 4, 2, 5, 8.
Okay, and then switch eyes.
3, 7, 4, 2, 5, 8.
Perfect. And so do you have corrective lenses in?
No.
Okay, so her vision in both the right and left eye is 20/30 with no corrective lenses, and that is cranial nerve 2. And then if you will stand up, please, and then just say when you can see, or say now when you can see my fingers. You need help?
Situation's not.
You got it? Okay. So just say now when you can see.
Okay.
Oh yeah, and now I'm gonna cover this eye.
Yes, or now. Now.
Okay, and then we're gonna switch eyes.
Now.
Okay, so that is peripheral vision, and cranial nerve 2 is intact. Oh wait, stand up one more time. Sorry.
Okay.
And then just follow my finger, but don't move the rest of your head. Okay, you can sit down. Cranial nerves 3, 4, and 6 are intact. And then can I get you to raise your neck and then go down and then side to side? Okay, she has full range of motion. And now I'm gonna get the pen light. Okay. Her corneal light reflex is present and symmetric. And then just keep looking straight. Direct pupillary response. And then just keep looking here. I'm looking into her other eye. Okay, consensual light and accommodation. And then if you will look over there at that plant, and now look here at my pen. Okay. Her pupils are equal and round and react to light accommodation, and that is cranial nerve 3. So now we are going to go to her ears, and they are symmetric on her face. The size is appropriate for her head. Is that tender at all? Okay, and color is consistent with the rest of her body. She has one piercing in each ear, and I'm gonna palpate on her masseter. Is that tender at all? Okay, and look inside. I see no discharge or lesions, and same over here. I see no discharge and lesions. And then I'm going to whisper 3 words, and then if you will repeat after me.
Red, white, blue. 1, 2, 3.
Okay, cranial nerve 8 is intact. And now if you will lift up your head just slightly. Her septum is midline. Her nose is symmetric. Is this tender at all? Okay, non-tender. Her nares are pink and moist, no lesions, no foreign bodies. And then if you will hold one nostril and breathe in and out, and then do it on the other side. Okay, she has her patency is present. And now we are gonna go to the mouth. You will open up. Her lips are, go ahead, not first. Her lips are pink. And her buccal mucosa is moist and pink. The roof of her mouth, and then when you lift up your tongue, the floor of her mouth is all moist and pink, no odor, clean hygiene, no lesions. Okay, now smile. Her gums are pink and moist, and she has 28 teeth. They are white, they are aligned. And now I'm going to put on my gloves. Oh, in her eyes, when I was inspecting those, they open and close completely when she is blinking. And her iris is round and hazel. And her, she has evenly distributed eyebrows and eyelashes, and they are also brown. Okay, so let me see your tongue, perfect. Her oropharynx is clean, no lesions, no odor, and then say ah. Okay, I'm gonna do that. Okay, her gag reflex is present. Cranial nerves 9 and 10 are intact. And then let me see hold out your tongue. Okay, it is symmetric, it is moist, it is pink, and then go left and right, and then poke in the inside of your cheeks. Okay, cranial nerve 12 is intact, and will you swallow? Perfect. Cranial nerve, I did that at the same time as you.
Okay.
Cranial nerves 5, 7, 9, 10, 11, and 12 are also intact. And so now I'm going to palpate her lymph nodes, and if anything is tender, let me know. So we have preauricular, postauricular, occipital, retropharyngeal, submandibular, sublingual, submental, anterior cervical chain, posterior cervical chain, and then perfect. Supraclavicular and then infraclavicular. And was any of that tender at all? Okay, so non-tender, non-palpable. Now we're gonna move on to her neck. The color is consistent with the rest of her skin. It is symmetric. Is any of this tender? Non-tender. Her trachea is midline. Is that tender? And non-tender. Thyroid, non-palpable. Was that tender? Non-tender. And then if you will resist against me. Perfect. Cranial nerve 11 is intact. And then if you will, we did up, down, side to side. Okay, now we're gonna move on to the upper extremities. Hang on, 1 second. Oh, I'm going to no, I already palpated. Palpate, hair, neck. Okay, we're just gonna go for it. We're gonna move on. Okay, so I'm going to undo this, or I'm just gonna roll up your sleeve if that's okay. Okay, so her arms are symmetric. I see no deformities. Oh, and her neck was warm in temperature. The texture was smooth and it was moist also. Okay, so her arms are symmetric. Temperature is warm. The texture is smooth. It's moist. I feel no edema. And then her skin is elastic, no tinting. Her fingernails are round. They are thick. They are pink. There are no lesions. Good hygiene. The capillary refill is less than 3 seconds. And then when you do your fingers together like this. Okay, there is no clubbing. And now we're going to do passive range of motion. Go up like this and tell me if any of this is tender. Okay. No crepitus. Was that tender? Okay. Okay, and was that tender? Okay, and then no crepitus, and now you will do your arms back like this, and then elbows bent, twist your wrists, and then fingers. Perfect. So she has full active range of motion, and then do your arm up like this. Okay, push towards me, pull towards you, and then grip my fingers. Okay, her muscle strength is 5 out of 5. Now we are going to do this. We're going to check out the anterior side of her chest. Okay. Skin color is consistent with the rest of her body. Is any of this tender at all? I'm going to feel down by her ribs. Okay. Her AP to lateral configuration is 1 to 2. Her breathing is unlabored. I see no signs of retractions, pulsations, sighing, or paradoxical movements, no lifts, thrills, or heaves. And we are going to listen now to her lung sounds with the diaphragm. Oh, I gotta put on my watch. Excuse me. Sorry about that, you guys. Just 1 moment. Okay. Okay, so deep breaths in. now I'm going to feel for the apical pulse. If you will lean forward just a little bit. Okay, it is 2+. And now we are going to listen to the heart sounds with 5 points. First, I'm going to do it with my diaphragm for 10 seconds. We're going to do the aortic first. Pulmonic. Herb's point. Tricuspid. And the mitral. Okay, now I'm going to switch to the bell. And we're going to do aortic first. Pulmonic. Herb's point. Tricuspid. And mitral. Okay. S1 and S2 were heard. And all of her lung sounds were clear and smooth bilaterally. Heart sounds, S1 and S2 were heard and no adaptation sounds. So now we're going to move to the posterior side. And her skin color is consistent with the rest of her body. She has a few macules. There is no curvature to her spine. Is any of this tender? No. Okay, non-tender. Her breathing is unlabored. Once again, no sighs, retractions, things like that. So now we're going to listen to the 10 points back here. And deep breath. All sounds were clear bilaterally, and now we're going to do her lateral sounds. And if you will stick out your arms. All of her lateral sounds are clear. Now we can put that back on. Got it. And we are going to lay down on our back next. Okay. Perfect. Okay, her abdomen is flat from the side. No signs of bulging, no pulsations. There are no signs of scars or lesions, bruising. We are going to listen for 15 seconds in each quadrant with the diaphragm. Sorry. All sounds were normoactive in all 4 quadrants. Now we're going to switch to the bell and listen in the epigastric region midline for any brewery. Okay, there's no brewery. And now I'm going to palpate. Let me know if any of this is tender at all. Is that tender?
No.
Okay, non-tender. She was not guarding. There are no appearances of masses, and the color on her abdomen is consistent with the rest of her body. You can sit up. We're gonna do lower extremities now. So her legs are symmetric. I see no deformities. Skin color consistent with the rest of her body. Temperature is warm, texture smooth, it is moist. There is no edema. Skin is elastic, no tinting. Her toenails are round, they are thick, there are no lesions, so there's clean hygiene. The soles of her feet, no cracking, and no lesions, they are intact. No cracking, no lesions, they are intact. And then her capillary refill, we're gonna do a few. Her toes, they are less than 3 seconds. Now we're gonna do passive range of motion. Okay. And let me know if any of this is tender at all. No crepitus. Was that tender?
No.
Okay, no crepitus. And then if you will stand up, and we're gonna do our legs out like this, bend at the knees, and then twist your ankles, and then squat. Perfect, and then you can sit back down, and okay, push towards me, push away, or towards you, and then lift up your feet, press down, press up. Okay, her muscle strength is 5 out of 5. And then if you will stand up, bend over at your hips, or bend over at the waist. Her hips and shoulders are aligned. I see no signs of scoliosis or kyphosis. She has full mobility and balance. Her spine is straight. Okay, you are good to go. Now I'm going to do your pulses. gonna start with temporal. Okay, it is 2 plus bilaterally, carotid, 2 plus. That one's really good. 2 plus bilaterally. Now we're gonna do her brachial pulse. There it is. 2 plus bilaterally, her radial.
Your watch ticking is so loud.
I'm really sorry.
No, it's just funny because I can hear it.
Okay, 2 plus bilaterally, and now we're gonna do her posterior tibialis. Dang, go girl. 2 plus bilaterally, and her dorsalis pedalis. I'm never gonna get that word.
It's a weird word.
I'm so sorry, Dr. Hargett.
I'm so sorry.
Okay, 2 plus bilaterally. Now I'm gonna look at my note card. Okay, done. Have a good day.